Hi, I'm Frank Spear. I want to welcome you to this blog. What I'm going to share with you today is a technique I've used for years to remove permanent restorations that have been cemented temporarily. You know, when you look classically, there's been a number of reasons through the years that we might consider temporarily cementing a permanent restoration. Things like a concern about the pulpal status of the tooth, aesthetic issues as to whether the patient's going to accept the restorations or not, occlusal concerns that we might have, and in implant restorations, especially with the old external hex systems, a concern about abutment screws loosening, so you wanted retrievability to be able to get access to the abutment screw without having to destroy the crown. The trick, of course, in removing permanent restorations is how do you grab a hold of them? Most of our permanent restorations these days are ceramic, and we can cement many of them temporarily, such as lithium disilicate, zirconia, alumina, metal ceramics. Much more dangerous to cement feldspathic porcelain restorations or lucite reinforced restorations like Empress. But the other ones I mentioned can certainly be temporarily cemented because of the strength of the restoration. Well, grabbing them with hemostats is problematic because it damages the porcelain. But GC America years ago came up with something called a crown removal plier, which basically is a plier that has rubber inserts that you then dip into a little paste, carborundum paste, or an emery paste, if you will. It's almost a gritty powder, and it makes the rubber then stick quite nicely to the ceramic. So I'm going to show you a video in just a moment, and the video I'm going to show you is of removing a permanent first molar crown that was temporarily cemented because of pulpal issues. I wanted to be sure that the tooth didn't need endo, and so we left it for several months in temporary cementation. Now the trouble is, whenever you grab a posterior tooth with hemostats and you try and rock it back and forth, what you're really doing is you're binding the restoration on the walls of the preparation. What you actually want to do is you want to pull the restoration straight down along its path of insertion. You can do that in the anterior because you can grab it and pull in that direction. Very difficult to do in the posterior. So a trick I've used for years is basically the concept of a fulcrum. And for me, I typically use toothbrushes as the fulcrum. So what I'm going to do is grab the first molar with the GC crown removal pliers, but instead of twisting back and forth, I'm going to put a toothbrush in the patient's mouth coming out the side, rest the crown removal pliers on it, and lift up in the front, which will actually then pull the crown off in the back. And you'll see it's a very effective technique at being able to get this restoration, which has been on there for several months with straight temporary cement, and still be able to get it off without damaging it in the process. So we'll go ahead and go to the video. Here's the GC crown removal pliers. We've got fresh rubber inserts in them. We dip them down into a little carborundum. And now we go to the mouth and at first get a good grip on the first molar crown. There's the toothbrush. We extend the toothbrush out the side, lift, and the first time I tried, the crown removal starts to slip, but sure enough, the crown pops off a few minutes or a few seconds later when I get a good grip on the restoration. So for me, this is one of those things, it's a little trick to keep in the back of your bag. If you have a permanently cemented crown you want off, even if it was put on with resin modified glass ionomer, I've actually gotten many of them off using this same technique. Grabbing them and simply trying to twist, I'm not very successful at. Grabbing them and using the toothbrush as a fulcrum has worked really well for me. So I hope you've enjoyed this little clinical tip, and I'll look forward to seeing you again soon.